Good morning. I'm Jenny Gary, Deputy Director for the Baldwin County Emergency Management Agency. And I'd like to take this opportunity to thank all of those on the front lines who are fighting the coronavirus in our community. All of our medical health partners, our first responders, our law enforcement, our EMS, our fire departments, thank you for your dedicated service. I also want to recognize that this week is Telecommunicators Week. We'd like to take this opportunity to say thank you for those who are on the end of the line when we need help. They're often heard, but seldom seen. Thank you for your dedicated service. I also would like to provide you an update for the progress for our response for the Baldwin County COVID situation. We continue to work very closely with our partners at Public Health, as well as our partners within the medical health community. I will let you know that our hospitals are managing the situation very well. We are speaking with them daily about their statuses to make sure that we have appropriate staffing as well as equipment to combat the coronavirus. We recognize that this time is very challenging for everyone. I want to encourage you to stay home and stay strong as we fight this situation together. Continue to use social distancing and good hand hygiene so that we can help stop the spread of COVID-19.
Good morning. Thank you for having me here today to speak with you regarding the Baldwin County response to COVID-19 and to provide you with a brief update. I would like to thank the citizens of Baldwin County for their cooperation and adherence to the orders that have been put forth by Governor Ivey and Dr. Harris, our state health officer. It has also been wonderful to see the outpouring of support from our community for our medical providers and first responders. I would like to provide an update on testing that's available through Public Health in Baldwin County. We have added additional dates for testing here at the Robertsdale Health Department, April 14th, April 16th, April 21st, and April 23rd. Testing will be performed from 10 a.m. to 2 p.m. Testing is available by appointment only, and you will need to call to be screened. The number to call is 251-947-1910. Other testing sites can be found by visiting the Alabama Department of Public Health online dashboard. So now I'd like to open it up for some questions.
Jenny, what is the proper use of gloves? Should we be using gloves, and if so, how do we handle them?
The CDC and the Department of Public Health does not currently have guidance for the general public to wear gloves when completing daily tasks such as shopping or running essential errands. However, if you are caring for someone with COVID-19, it is recommended that you wear gloves. In addition, when you are cleaning or sanitizing surfaces, you may also wear gloves to protect yourself from those cleaning solutions. There is guidance for the proper removal of gloves on the CDC website. Improperly removing the gloves can expose you to contaminants that you collect while you're wearing the gloves. After removing your gloves, dispose of them properly and to wash your hands with soap and water. If soap and water is not readily available, use an alcohol-based hand sanitizer.
What are the recommendations for wearing a face mask?
The CDC and Department of Public Health does not currently recommend that the general public wear N95 masks or surgical masks, as those should be reserved for the medical community. However, if you do have one already, you may wear it. The CDC has recommended the use of cloth face coverings for the general public. There are guidelines for these and instructions on how to make these that can be found on the CDC website. If you are going to wear a face covering, make sure that it fits snugly but comfortably, is secured with ties or ear loops, that it includes multiple layers of fabric, allows for breathing without restriction, should be able to be laundered and machine dried without damage to the shape. You do make sure that you do not put any type of face covering or mask on a child under 2 years of age. Most people are not accustomed to wearing a mask or a face covering, so you may find the urge to adjust it or touch it, but you really want to try to not do that and try to keep your hands away from your face as much as possible.
Remind us, Jenny, what are the recommended guidelines for hand washing?
Okay. You want to make sure that you are washing your hands after using the restroom, before, during, and after preparing food, you eat, after caring for someone who is sick, changing diapers, or cleaning up a child who has used the toilet, after blowing your nose, coughing, or sneezing, handling pet food or pet treats, or after garbage. When you're washing your hands, wet your hands with clean running water. It can be warm or cold. Apply the soap. Lather your hands by rubbing them together. Be sure that you're cleaning the backs of your hands, between your fingers and under your nails. You want at least 20 seconds. Rinse your hands under clean running water and then dry your hands using a clean towel or air dry them. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. And you want to cover all the surfaces on your hands until they feel dry.